Hi, my name is Anna Clements, and this is Hannah Judge, and we are the founders of Broad Street Maps.
We make maps for public health organizations because we believe in the power of visual data to inform decisions and communicate impact.
We turn static spreadsheets into dynamic maps that enable organizations to make more informed decisions and to deliver care to where it's needed most.
In 1854, the city of London was ravaged by a cholera epidemic. Over the course of 3 days, more than 100 people died, but nobody knew where the disease was coming from or how it was being spread. Dr. John Snow decided to make a map showing all of the deaths from cholera, and this led him to the Broad Street pump. He removed the handle of the pump, and all new cases stopped. It was the first time that maps were used to identify the cause of a disease and also directly inform public health policy. It was also the beginning of modern sanitation.
John Snow proved two things. First, that visualizing data makes it more powerful and allows you to see new patterns. And second, that geography is a key determinant of health. Where you live affects how healthy you are.
Despite the fact that he proved this more than 150 years ago, maps are still extremely underutilized in the field of public health today due to expensive and complex tools, tight budgets, and overworked staff. So we believe that this is extremely problematic because it forces organizations to make critical decisions about service delivery without being able to see the full picture.
Now imagine for a minute that you run a hospital in rural Haiti and you're trying to decide where to put your next clinic using a spreadsheet like this. Where are all the existing hospitals? Where are the gaps? Who lives there? Would they even benefit from a new facility?
A map lets you see patterns in your data across space, time, and scale. So you can use this to look at where all the current facilities in Haiti are and see how far you have to travel in order to get there. You can also look at where all of the existing road networks are in relation to those facilities and run analysis on both data sets at the same time in order to identify the exact locations that are more than 10 kilometers away from a hospital and also more than 5 kilometers away from a road. So this allows you, the decision maker, to pick out the most remote and vulnerable places and populations.
And this gets us really excited because we are geographers who are really passionate about global health. Between the three of us, we've worked with more than 10 organizations in 5 different countries. Our experience working in the intersection between geography and public health positions us to make a really unique contribution. We start by sitting down with each of our clients, hashing through their unique problems and goals, and together building projects that help them get their patients the care they need.
We provide a variety of services to our clients, like Gardens for Health International in Rwanda. Gardens for Health combats chronic child malnutrition through agricultural solutions, and they're interested in knowing exactly where every patient lives and how well each family is responding to their individual treatments.
Over the course of the time that we were there, we helped them optimize their data collection and survey design for visualization. We trained their incredible staff in how to use handheld GPSs, and we spent 5 weeks hiking to collect the exact points of latitude and longitude for more than 500 homes. The goal being to visualize the impact of their programs, understand where things could be improved, and communicate their work to their donors in their annual report.
So our maps provide value in 2 major ways. First, as data analysis tools that inform decision making, and second, as a way to communicate impact in a much more visual and compelling way.
Over the course of the Fledge program, we've been showing our maps to potential clients, doing extensive customer discovery and development. More than half of the groups that we've talked to have become paying customers. Over the past 10 weeks, we've quadrupled our number of projects from 3 to 12. We've also incorporated as a for-profit social enterprise in the state of Washington, and we've added a thank you. And we've added a creative director to our team.
But 12 projects still is definitely not enough. So we're using these high-touch, high-cost projects to pull out the best practices and most valuable features. And we're using these to inform a series of templates that we'll use to create a mapping product that can scale like software.
And in order to get there, we're leveraging partners like Medic Mobile It's a group that uses cell phones in underserved communities to improve health. They work with over 30 organizations in 18 countries, touching more than 5 million people. We are collaborating to harness the joint power of cell phones and maps with the goal of shipping out a product this summer.
Our work is a critical missing piece in global health today. Maps and technology have the potential to accelerate positive outcomes and better health around the world. In 5 years, we want it to be the rule rather than the exception for maps to be used as key tools in decision making.
If you know of any organizations or tech partners that can help us get there smarter and faster, please come talk to us. We hope you feel inspired by the potential of maps. Thank you so much for coming.